Hi, everybody. I'm Dr. Mike Khadavi. I'm a sports medicine PM&R physician in Kansas City. And just by way of quick introduction, I'm primarily a sports medicine and orthobiologics physician, and I'm the fellowship director for the University of Missouri Sports Medicine Fellowship and assistant professor at University of Missouri. So one of my greatest most exciting areas in sports medicine is the use of intraosseous orthobiologics. And simply put, what that means is we put a needle into a bone, usually just above or below the cartilage, which we call subchondral, and we inject PRP or bone marrow concentrate into that area of bone, unhealthy bone. This is so powerful because the main problem in arthritis as it becomes more severe is bony. It's pain that comes from bone just under the cartilage. And in patients who have unstable joints, injecting outside of the joint space, which we call extra-articular, is extremely important. That's how we can resume stability of a joint. Clearly, this is not something that any of us orthobiologic performing physicians can do on our own. The, of course, the greatest area here of improvement comes from activity modifications and an exercise strength stability regimen, which is why C3 is so exciting to me because none of us can do any of this on our own. It takes a team, which is one of my favorite parts of being in this really great, beautiful field. A question I get all the time is when should somebody refer a patient for a potential orthobiologic or intraosseous procedure? And there are a couple answers to this. The main answer is when a patient just isn't improving like you would expect. In arthritis, there's a good argument, however, to refer sooner because we now know from hundreds of studies that orthobiologics, PRP, bone marrow concentrate, especially intraosseous orthobiologics, can reverse, slow, and prevent further osteoarthritis progression. It can delay or even prevent the need for knee replacements. And I get asked this question from my physician partners, usually surgeons, all the time. When do I refer to physical therapy? And that answer is almost all of the time. When is it that a patient with any joint issue is not going to benefit from better stability of their joint? So I very much look forward to seeing everybody in June in Colorado for the annual C3 Summit, and I look forward to talking and hearing from you guys there.